Can functional neurology really help dysautonomia? With dysautonomia, there's way more to the story than just the whole vagus nerve and the peripheral autonomic system. Just your brain's ability to know where you are in space, to be able to stand up, involves your brain and it involves your neurology. And this complex interplay between your cerebellum and different regions of the brainstem, even your eyes and your vestibular system, to help you get blood flow up to your head. So if you have orthostatic intolerance, POTS, dysautonomia that's associated with changes in gut function, we can figure that out. Not only are we going to run in-depth labs and look for anemia, infection, other inflammatory issues, including Lyme or mold or other chronic neuroimmune issues that might be flaring your immune system, causing issues with dysautonomia. Hi, I'm Dr. Jeremy Schmoe, founder of the Functional Neurology Center in Minnetonka, Minnesota. We work with patients with unresolved post-concussion symptoms and other complex neurological issues. Our approach to complicated neurological issues is very different from other clinics. We use the latest technologies and a combination of functional neurology, functional medicine, and chiropractic care to get to the root cause of what is causing your problems. With this approach, we're able to get you back to optimum function and get you doing the things that you love to do. Can functional neurology really help dysautonomia? We're also going to look at the neck, and we're going to look at the way that the neck moves, because that also can affect how you get blood flow to your head. In addition, we're going to look at your neurology through a variety of means, ranging from graphing your eyes to looking at your balance. You need to know where your body is in space. That's the basics. And if you don't know where that is, you're not going to be able to get blood flow up to your head, and you're going to have symptoms of dysautonomia, like feeling foggy, feeling like you're faint, feel like you're lightheaded, and have neurological fatigue. There is hope. There are answers. Click the link you see with this video to schedule a consultation with my office today.